zoom in on that. Unlike the M24, this is negative electrodes. Show us the side. You get 40 of these gold-plated microelectrodes with the uncoated tip, 500 microns uncoated, and you get 40 of them. It's a larger footprint. You go down to 7 millimeters, not 5 millimeters like the M24, or 4 millimeters like the M12, the prime. You get a long fixed, a cycle, and you get a burst in a scale, but not a double burst or scale like the M24, a triple. You treat 3 layers in 1 pulse. You create 2 layers with the M24. And so let's look at her tummy. Let's look at her tummy. Tilt down, show me her tummy. We marked her out before with an X marks the spot. That's what I call the apex. When you're doing Morpheus M40 treatments, or after the break we're going to do the quantum, think of an outer thigh, an inner thigh, a submentum, a jowl, an arm, or like this epigastric fat collection as a mountain. And if you're a liposuction surgeon, this is intuitive. I take out more fat under the top of the mountain than the sides because I want the whole thing to flatten. If I take fat out equally, it's still a mountain. It's just a smaller mountain and people see a bulge. It's called apex management. Manage the apex more assertively than the sides so the apex comes down more than the sides. Take the top off the mountain. Does that make sense? And so over X marks the spot, show me a 7 fixed. Give me a 7 fixed, and you're going to put that over top of the skin there, Shelby, and stay on that skin for 4 seconds. Go. 1, 2, 3, 4. I am 6 millimeters deep. I'm leaving it for 4 stacked pulses. What am I doing? I'm going from 600 microns to 1600 microns of dead fat. I'm doing lipolysis. Now I can do a 7 fix and a 6 fix, then 1 pass of 753, 1 pass of 642 for the FSN. I've tissue-targeted fat destruction, and I've got 753, 642 for FSN. I'm going to treat that over the X marks the spot with the fixed, but I don't do fixed right out to the sides. I only do 753, 642. So I apex manage the top of the mountain, reduce the mountain. So do your 7, 6, and 6 fixed, and then a 753, 642 right out to the sides. Let's go back to both PowerPoints while we're doing the central treatment. And so we have a strategy for tissue targeting on the submentum, on the jowl, on the nasolabial fold, on the eye fat pads. I'm going to show you all that tomorrow. This is the strategy on a body. Treat the apex with long fixed pulses, and then treat the apex with double, triple bursts, but take that triple burst right out to the sides of the mountain. So it collapses like this. So you take the top of the mountain down, and the patient sees less of a bulge.